So in approaching respiratory diseases, okay, for the different types of respiratory diseases which we spoke about, acute respiratory distress syndrome. Now, one of the mechanisms that could actually lead to a patient having a lot of difficulties with breathing is what is known as damage to the alveolar-capillary membrane. Okay, so what is the alveolar-capillary membrane? What is their functions? All right. Of course, when you know the functions, you now know that somebody, if it is damaged, you have this type of issues coming up. So damage to the alveolar-capillary membrane, if there's damage to it, you're just trying to disrupt the critical interface between where oxygen and carbon dioxide. All right, there's an exchange of it. You understand? Oxygen getting into the blood, carbon dioxide being pulled out of the blood, carbon dioxide going into the lungs, then being set into the atmosphere. So these are a healthy one should look like. But when it's damaged, of course, you are now trying to see this border is like your custom border in your country, trying to checkmate the goods that come into the country and the goods that go out of the country. So of course, if you are damaging it, oxygen and carbon dioxide exchange is disrupted. You understand? So this could be one of the reasons why somebody is having difficulties in breathing. So please, you could pause and observe this slide, okay, taking note of each of the words that you see here. So what happens, of course, the ultrasound barrier is essential for you to be breathing very well. So if you have injuries to it, it will not cause a lot of respiratory system diseases. Do you understand? So what happens when it's damaged? There's increased permeability, so a lot of fluid is leaking in and out. Okay, so the air now is not really having a space. Okay, so surfactant loss, there's inflammation and edema, there's formation of hyaline membranes. You understand? So this is another picture trying to show you a normal alveolus and trying to show you that another alveolus that have been damaged. All right, show you a lot of things that have been infiltrated into the alveolus. Okay, of course, including fluid. Right, we have fluid occupying where air is supposed to be. Okay, so such a person is having a shortness of breath. You understand? So what could cause all those issues? Could be infections. You have the examples there. Could be traumatic issues, chest injuries. Could be inflammatory issues, like the acute respiratory distress syndrome that I was telling you guys about. Could be chronic issues. That's issues that have been there for a very long time. Could be heart-related issues. Okay. So clinical consequences: such a person is not breathing well, so the oxygen reaching organs is not sufficient. Respiratory failure, and tissues can die. All right, leading to fibers replacing those tissues. Okay, that's fibrosis. So diagnosis and imaging is chest x-rays or CT scans. You do histology, all right, just to actually identify the issues. Then pulmonary function test, you want to still see, all right, how well the person is breathing and all. Then I think basically that's it. Treatment, of course, you are dealing with an inflammatory condition, so all those anti-inflammatory drugs. Okay, and the person is having difficulties in breathing, so oxygen therapy is very much more needed.